Hello, friends. Yesterday, all of you had asked me certain questions on COVID, but as I told you, I am not an expert and I might have ended up misguiding you. So I requested Dr. Ravi Malik, who's a topmost specialist, to please find some time. He was very busy today taking care of his patients, as well as he was on multiple debates. You must have seen him on TV, Aaj Tak, Republic Bharat, and so many others. But because he is very kind, and I have a reason to thank him for one more thing, he's taken really good care of me while I was undergoing COVID, and you all are like my family. So I thought that what care I received, I would request Dr. Malik to tell you some odd points which you can do at home. So thank you, Dr. Malik, for doing it and coming on the English YouTube channel. And tomorrow I would request your time for Hindi because on Twitter a fight has started. Why am I doing it on English and not on Hindi? So thank you for coming, Dr. Malik.
Yeah. So first of all, thanks a lot, Ishkaranji, for giving me the opportunity. And it is my proud privilege. Why? Because of two reasons. Number one, I love speaking on COVID. And number two, I was wishing to come on your channel because I am also one of the subscribers for your channel. And I've been seeing your all the videos, and they have opened a kind of a legal mind in me also, and has made me more aware because we doctors have a tunnel vision. So thanks a lot. It is my proud privilege and a great day for me. Now, as far as the COVID goes, let me tell you, I have a very close relation with COVID. Why? Because of three reasons. Number one, me and my entire family, all of us are doctors, so we all suffered from COVID together. In fact, I was to be given oxygen also, so that is one issue. Secondly, I run a COVID hospital, which is right now we are having 45 patients of COVID right now admitted there. And in last pandemic of COVID, we have treated more than 1,000 patients with not even a single death. We have given a lot of plasmas also, and we have put the patients on ventilators also. So that is my second association with COVID. The third association is that I am also, our center is also giving COVID vaccines. So I've got a very good insight into, and I'm a pediatrician, so I take care of the pediatric COVID patients also, and also the adult patients which are admitted in my hospital. So I supervise my physicians and the intensivists and everybody. So now let us come to the point. What is the current situation of COVID? As you know, it is an extraordinary type of a unprecedented type of a unpredictable catastrophe. The most important thing is it is unpredictable. So we need to change our strategies as the virus is changing the strategies. So as the virus is mutating, we will also keep on mutating our strategies. So it is very important for us to understand that. So what was the situation of COVID in March 2020? What was the situation of COVID in July 2020 is immaterial to us. What is the situation of the COVID right now today on 12th of April 2021 is the most important significant factor. So let us now focus down on what is the situation today. Let us see the data and the numbers. Just about a month back, that is on 10th of March, we were having just 16-17,000 cases per day in our country. And today, after just 1 month, we are having 1,69,000 cases today. So you can imagine we have had an upsurge of 10 times, which is terrible, which is scary, and which has never been seen. And it is the kind of explorative growth, the geometric proportion growth has happened, and we are getting a branch of patients. So this is one situation which I will like to introduce you to this monstrous illness now. Now look at the future. Although it is unpredictable disease, it is difficult to predict about the future, but seeing the past 1 month situation, if it only doubles, what to talk of 10 months, 10 times in next 1 month, we can expect even 10 times. If it has increased by 10 times in last 1 month, why not? It will increase by 10 times. So maybe let us presume it increases by 2 or 3 times. Even then it will be a big catastrophe. Why? Because of the 2-3 reasons. Number one, our country is very large. We are comparing with UK, USA. You try to see what is the population of UK, just 7 crores. What is the population of America? It is just 35 crores. So we are sitting at
35.
1.38 billion of population, 138 crores of population. So it is a tremendous population. And the moment it takes a geometric proportion in our population, it will be a big disaster. Moreover, our health infrastructure is also not that strong. what is there in the developed countries. So we also need to be extremely careful. And one more phenomena has started occurring. I will say it is a syndrome, that is post-vaccination overconfidence syndrome, PVOC. Now, the moment vaccine has come, since I told you that my hospital is giving vaccine to the patients, so patients are thinking that look, the COVID has gone. This is the worst thing which is killing the patients, which is making this exponential rise in the cases. Why? Till today, let us go to data again, because data never lies. So you will understand that we have vaccinated only to 1% of our population. Yes, I'm right. We have completely vaccinated only 1% of population. Agreed. We have given more than 10 crores of vaccines, but it doesn't mean anything, because the complete vaccination is once you give 2 doses of vaccine. So 2 doses of vaccine have been given to say 1.38 lakh of people. So in a population of 138, crores of people, so 1.38 crore of vaccine given, 2 doses given comes to just 1%. So why are we confident? We need to increase our herd immunity to the level of 60 to 70%. And right now the vaccine herd immunity is only 1%. Second very important point is that 41% of our population is below the age of 18 years. And they are all vulnerable. There is no vaccine which is available in India which can be given to a child who is less than 16 or 18 years old. And it is not going to come in coming 4 to 5 months, because as you know, the trials take time and the trials have not been started till today. And although approvals have been given to Covaxin, but trials will start and then the vaccine will come. It is usual for every vaccine that initially it comes for the adults and then it comes for the pediatric patients. So it is okay. But right now we don't have any
Doctor
vaccine for the children. And
Dr. Malik, but
it
it
is very
is
important. They are vulnerable. Yeah.
Dr. Malik, if I may ask you a question, because you talked about children and there are multiple questions. A lot of people are asking, so I will ask you. First question, Dr. Malik, it's a common perception that it doesn't affect children or it is not so bad for children. Like you are saying, vaccine. Is it that common perception which I have heard? Is it true that it is not really affecting children and it is something just for adults, or are children also very vulnerable? What is the situation vis-a-vis that?
Very good question, Ishkaranji. I will tell you what is the situation on ground. As far as our experience of classic COVID has been there, which happened in 2020, world over the data are that the children who were less than 18 years, they have accounted only for 2% of the total cases of COVID. So it is very tremendous, because otherwise world over, the people who are less than 18 years world over, their population is 35%, but they have contributed only 2% to COVID. So we are very right that COVID incidence in children is much less as far as the classic COVID goes. Number one. Number two, it is not that children have not died, but the mortality rate in children has also been low. So we have lost children, but the mortality rate is also low. And most of the children with classical corona, they have developed only mild disease or asymptomatic disease. So as far as you are absolutely right in asking that COVID has been protective for children, and COVID has been protective to decrease the mortality also in children. Mortality has not been good. But now our concern is, since the adults are getting vaccinated, so virus is also very clever. It will change the mutant strain and will try to go to the vulnerable group who is not vaccinated. So number one. Number two, the virus has already started affecting the children. This new strain of virus has already started infecting the younger population. How much, to what extent? Of course, the data will come. But on the ground, I can say that it has started affecting the younger population. So the things are little different. As I rightly told you in the beginning, that it is an unpredictable virus. Tomorrow you never know. This virus might get protective for elderly and might start getting, the new strain might start getting only the children. As for swine flu and other flu, they affect children more than the adult population. So you never know how the virus changes its mutant strain. So this is the whole. So I have given an overview picture what is happening with corona today. everyone knows that what we need to take precautions. So I will just be putting in 2 words. So thereafter we will have a question answer session. So
Because
that
there are a
we
lot
do
of
not
questions, Dr. Saab answered by.
yeah. So only 2 things I will like to say. Anybody who is getting the opportunity to get vaccinated should immediately get vaccinated, because 70% corona will not touch you if you are vaccinated, and 30%, even if corona occurs, it will occur, then it is not going to kill you, or it is not going to take you to the ICU, to speak the least. So by and large, if we take the vaccine, then 70% corona will not happen with us. The second will not infect us, and the second thing is that 30%, if at all it infects us, it is not going to make us very sick, so it will not be severe.
All right. Dr. Saab, now I will take some questions. Lot of people, I'm repeating this. This is not medical. A lot of people are saying I need to speak in Hindi. This is a new YouTube channel and it's going on Facebook. Hindi, I will request Dr. Malik to come tomorrow. You are all my family. And Dr. Saab is like a family. He took my care like a member of the family. And I thought he should answer all your questions. That is why he's here. And I will request him for Hindi tomorrow. So today, please ask only in English. Dr. Malik, on vaccination. That is the question I hear a lot, because there are two things people fear. That might be rational, that might be irrational. One, they fear that vaccination is not making you immune from it. It is not like what we polio vaccination. You have that, and polio is effectively not a problem if you are vaccinated. So they are saying that it is even after vaccination it is happening. Second, people are scared of the side effects of vaccination. Uh, so, in your view, are these fears genuine, or these are fears which are just out of misinformation or lack of information?
These are because of lack of information, ignorance, and to some extent illusions which has been created by the people who are non-technical and non-professionals. Now, I will take each and every point. Number one, as far as the safety of vaccine is there, I can vouch upon it. It is absolutely safe vaccine. Saying that, it doesn't mean that vaccine will not have any side effects. You may get little fever, you may get little redness and swelling at the site of injection, you may get this thing, but no serious side effects, no death which has been attributed directly to the vaccine has occurred till now. We have given more than 10 crore vaccines. It speaks volumes about the safety of the vaccine. This is number one. Number two, no vaccine is 100% protective. If we talk of chickenpox, it protects only 95%. If we talk of typhoid, it protects only 67%. Maybe there are many vaccines like BPT, polio, they protect maybe to the tune of 99.9%. But till now, even polio is not 100% free. Maybe it is 99.999%. So every vaccine has its own efficacy. But the most important thing is that even if you have given chickenpox vaccine and chickenpox happens, then the grade of the severity of disease will be much less had you not been given, because partial antibodies are there. So they will take care of you. So similarly in this vaccine, 70% you are fully protected. This has been proved not only in the studies, but it has also been proved on ground, because we have given 10 crore of vaccines and practically without any much of side effects. So people were initially skeptical, because it is good that initially we, like healthcare workers, I was one of the first ones to get the vaccine. We volunteered to take the vaccine. Initial skepticism is understandable. But now, after giving 10 crores of doses, it is absolutely safe. We should not think about it. So safety is there, protection is there, and we should take it.
So, people, to your specific question on fear of vaccination, Dr. Malik has made a very valid point that we have given it to 10 crore people, at least one dose. And if something was bad with it, it would have come out by now, because 10 crores is a huge, no trial is more than a few thousand. This is 10 crores we are talking about. So that, Dr. Malik, and also one request to people, you are more than 600 watching on YouTube and Facebook together. So a lot of questions are coming. If I miss some questions, my apologies, because I can't read so many questions so fast. I have told my team they keep on putting some questions. Dr. Malik, one question which a lot of people are asking, which is again connected to vaccination, is Some people have BP, some people have sugar, some people have diabetes, some people have various other things, which I'm not naming the exact things people are asking. Are those people safe to take vaccine, or they should take a doctor's opinion before they go for vaccination? What is the situation with somebody saying hypo? I don't know what this word is. Hypothyroid is something. So anyway, some conditions with some people. So, what do people with high BP or sugar or these sort of people do with vaccination? Just book an appointment, or should they talk to their doctor first and then go for it?
Look, there are certain absolute contraindications to the vaccine. We cannot give vaccine to certain group of people, like those who are less than 18 years, there is absolute contraindication. Those who are in pregnancy and those who are lactating, we cannot give this vaccination. Those who are on immunosuppressive therapy in proper dose, we cannot give them the vaccine. And those who have got a severe anaphylactic reaction to the previous COVID vaccine, we cannot give them the vaccination. So these are certain absolute contraindications where there is no-go area. Now, then
Contraindication,
there are
doctor, sorry to contraindication in simple language being
yeah,
not to.
contraindication means that in these four set of people, I will again repeat, we cannot give vaccine. So it is a no-go area. Less than 18 years, pregnancy and lactation, anybody who is on immunosuppressive therapies, and lastly, it is the last injection of COVID has given us severe anaphylactic reaction, not small redness or this thing. So this is no-go area. Now, diabetics, hypertensives, heart disease patients, kidney failure patients, liver failure patients, they all can be given vaccine without any problem. But the only thing is, those who are seriously with liver failure, with seriously with the kidney failure, they should consult their doctor before taking the vaccine. But usual diabetics, usual hypertensive, usual heart disease patients, in fact, those who are taking blood thinners also, they can be given this vaccine easily. Moreover, after giving the vaccine, as a precautionary measure, we keep the patient with us for half an hour so that most of the major problems they develop immediately. Most of the severe allergic reactions, they appear immediately, maybe 5 to 10 minutes after giving the vaccine. Since I have given thousands of vaccine in my hospital, we have not witnessed even a single serious adverse effect. In fact, 70% of the patients, they don't get anything. 30% of them, they may get little headache, little body aches and mild fever, and maybe some swelling over at the site of the injection.
So I hope, friends, that has answered your question of how to go for vaccine. Four categories absolutely don't go. Others, it is advisable to go because that is the solution. Dr. Malik, one more question which people ask is about this age. I also, being under 45, don't get vaccination. But there are some people, some lady, I think, commented that she has dialysis or something and she can't get vaccination. So, what is your view on this? Should the government expand it to people under 45, or the government doesn't have the resources or priority? How do we deal with this 45? My layman view is people who need to go out and work, they can bring it to the home. So that is my layman view. But what is your view, and what should be done on this 45 age question?
Look, we must understand what is the intention of the government. By and large, if I tell you, the government's intention is to decrease the death rate from COVID. So, during the first, second, or third phases, they are trying to cover only the patients where the death rates are very high, or those who can be super spreaders, like a doctor like me. I can be a super spreader because I run a COVID hospital. So most of the patients are likely to come to me, so they can get infection from me. So they have tried to, initially, frontline workers were targeted for the vaccine so that super spreaders can be controlled. Secondly, they have targeted the people who were more than 60 and those more than 45, those who were having comorbid conditions like diabetes, hypertension, cancer, blah, blah, blah. So that was the second phase. Now in third phase, they have covered the people who are more than 45. So strategically they are moving, because once they cover all the people who are more than 45, so by and large, they will be able to control the death rate. That is very important. Death rate below the age of 45 is comparatively very low. It is not that we have not lost people who have been less than 45, but it is very low. But the only one thing which I've been requesting to the government and on different advisory boards and media is that the people who are less than 45, but they have comorbid conditions like diabetics, like hypertensives, like heart disease patients, those who are less than 45, they should now also be immediately given the vaccine to decrease the mortality. So government is going in a strategic way. Ultimately, we must understand that it is the greatest ever public health campaign which has been overtaken in this on this planet. This is the greatest public health campaign with 138 crore of people getting the vaccination as early as possible. So government has to see the logistics and everything. But one good news has come that Sputnik V vaccine today has been approved by the government, although it has to take the final nod from DGCI. So anyway, once we get the DGCI nod, then of course Sputnik will also be available for the vaccination to other people. And I think sooner the government is going to open for people who are more than 18 years of age.
Dr. Malik, also a lot of questions are coming here on which vaccine to take, which not to take. Is there any difference, or you think whatever the government approves, take it? What is the, or is some data coming on these aspects? Is Sputnik safe? I don't know. See, because this is also coming from a lot of foreign audience. Somebody from Austria, somebody from UK were asking me Johnson one shot, which is not available in India. So I don't think so. At least I don't think so. Johnson is available in India. So these are questions coming from global audience. Is there any difference, or if the regulatory authority has approved it, go for it?
Till today, 13 vaccinations have been approved by the regulating authorities. May it be Moderna, may it be Pfizer, may it be Johnson and Johnson, may it be Sputnik, may it be Covishield, may it be Novavax, or may it be our Covaxin. So in India right now, two vaccines are available. One is Covishield and one is Covaxin. So there are different kind of views people are saying, but as far as I will bulldoze my opinion that there is nothing to choose between. You can take any of the vaccine. They both are safe and they both are effective. So there is absolutely nothing to choose between them. Yes, initially there was a skepticism because Covaxin has not completed the third phase clinical trial. So people were having little reservations on that. But now the interim report of Covaxin has also come, and a complete report of Covishield is also there on the table. So I don't see any reason that there is anything to choose between the vaccines. So whichever vaccine is being offered to you, you can take, and they both are safe and they both are
So as I said, doctor, this is also Prachi Singh says I took Pfizer. That must be abroad. A lot of people from abroad. But this question, since you said this is affecting children, are there some special precaution for children that one can take? This is by Miss Banerjee, I think. Or is
Yeah.
it the same?
Since COVID is a respiratory infection and it goes from one human being to the other, maybe a newborn child or maybe a 90-year-old person, so the precautions, they remain the same. We have to take respiratory hygiene, we have to take care of hand hygiene, and we have to, of course, maintain the social distance. But one thing I will like to point out that symptoms in children are little different from symptoms in adults. So all the parents should know children will present with diarrhea, nausea, vomiting more often than adults. Although diarrhea does occur in some of the adult patients of COVID, but children are likely to present with diarrhea, nausea, and abdominal symptoms more as compared to adults. In adults, fever is there in more than 64% of the cases, but in children, fever is there in about 56% of cases, so there is a mild difference. Children will have more of running nose and less of coughing, and adults are likely to have more coughing. So it is a fine tuning of the symptomatology between children and adults, but by and large, the precaution remains the same.
By and large, Dr. Malik, I had asked you for 10 minutes, but it is so informative and people keep asking questions. We're on 25 minutes, but I will not take more time because I want you tomorrow also. So one last question I would ask people is, just to encapsulate vaccination to be done, you think that is, if you're eligible, just go for it. Don't think about it. If you are, unless those 4 or 5 categories you mentioned You have small BP or small sugar, go for it. Children, you have already said this could affect children also. So it is not that you just send children without precaution outside. You have to have all precaution for children also. And last question, even though it's a very basic question, I want to ask you is what are the broad do's or don'ts in the first phase? We had lockdowns, and even people in the same colony were not meeting their relatives. But now everybody is going out. So, what are the do's you feel at individual level to be done even now, which can improve our chances of not getting COVID?
Look, under the backdrop of fact that we have increased the COVID cases by 10 times in last 1 month, I will advise all our family members of your channel that they should impose a self lockdown. Government may or may not impose it. You impose a self lockdown. Just move out of the house only when it is very necessary or you are going out for your living. Just for the heck of it, for the leisure activities or going to restaurants or going to maybe pubs or bars should be immediately, it can be life threatening, it should be immediately curbed, it should be decreased. But we should impose a lockdown, we should wear masks, maybe better to wear two masks because it will give more protection. And a study in UK has said that if 15%, just 15% of Indians, they wear masks, they are going to avoid the lockdown and they are also going to gain $1 trillion otherwise which they are going to lose by COVID. So the mask is so important, hand hygiene is so important. I can vouch upon it that if you are taking due precautions, you are wearing mask, you are taking full social isolation and you are taking care of your hand hygiene, corona will not be able to touch you.
Doctor, last question because this is also coming very frequently and it's been reminded. What is efficacy of vaccine after one dose? As my parents have to travel before second dose. So what is happening was there is a huge gap between first and second dose. So what is the situation after first dose?
Look, no studies have been done after first dose of vaccination because studies are there where after 2 weeks of vaccine, after the 2 weeks of the second vaccination, we have done the studies where the protection rate is to the tune of 70 to 80% in both the vaccines if we go that way. But there has not been any study that how much will be because after first dose that is an incomplete vaccination, so scientifically it is not correct to see how many antibodies are formed. But having said so, some of the anxious patients have come to me after getting the first dose and they have got their antibody tested. So you can say that in almost 50% of them, they have developed some kind of antibodies. So the antibody production will start. It is not like that you give only one dose. Pfizer has done the study. Pfizer says that after first dose of vaccine, there is 90% of protection, and after second dose of vaccine, there is 98% of protection. These studies have been done by Pfizer, but no study has been done by Covishield or Covaxin. And by and large, our complete vaccination is there only once we receive both the doses of vaccine.
Thank you, Dr. Malik, so much. And as somebody else says, thank you so much for it was so informative. Thank you, Dr. Malik, for taking out time and talking to ISBP family and telling them all the precautions they can take and be safe. And thank you for the superb job you are doing, anyways, of taking care of patients. Doctors are at the highest health risk, and still they are providing treatment to everybody. So, as a citizen, thank you so much, Dr. Malik.
So nice. I also need wishes from all the family, and so that we should work with full zeal and should try to protect as many lives as possible. Thanks a lot, Ishkar. So
Thank you,
nice.
Dr. Malik. Thank you.